So wait, what are we doing today?
Well, for this video, you'll be trying 3 different acne treatments at 3 drastically different price points to see which one's the best fit for you.
Wait, but why do I have to do it?
Haven't you heard yourself like complaining about like your skin for like the last 3 weeks?
Hey, okay, you do have a good point, and I'll do it, but how am I gonna figure out which one's the right one for me?
Well, we've developed a criteria based on the cost, mechanism, efficacy, safety, and common use to see which one's the most worth it for you.
Oh, okay, I might as well get going. Okay, here we are. But I had a question. How will I know which specific product to actually try out?
Well, we've actually done some research so we can help you along the way.
Oh, okay. But wait, what's the first product that we're trying out today?
Oh, it's just tea tree oil.
Oh, okay, but like, how will I know the effects to it for my skin?
We'll let you know once we get inside of Shoppers.
Oh, okay.
Okay, so tea tree oil is a relatively common choice for self-treating acne and is used as a home remedy. Plus, it can be relatively cheap. Tea tree oil has broad-spectrum antimicrobial activity and anti-inflammatory activity. This means that it can kill the bacteria and reduce inflamed areas of acne-prone skin. To summarize from a 2015 scientific paper, 5 studies evaluated products containing 5% tea tree oil and found that lesion numbers were reduced, with reductions ranging from 23.7% to 62.1% after products were applied for 4 to 6 weeks. Overall, these data suggest that the use of over-the-counter products containing greater than or equal to 5% tea tree oil is likely to reduce numbers of acne lesions when applied twice daily for multiple weeks. Though there were some adverse events after the application of tea tree oil products in 5 of the 7 studies analyzed from the same scientific paper. Some stated events included minor burning, stinging, scaling, itching, redness, and dryness. The rates of adverse events were higher for benzoyl peroxide than tea tree oil at 79% versus 44%. The application of tea tree oil within the skin is another factor that may influence its efficacy. Tea tree oil penetrates poorly into and through human skin, with most of it being lost to evaporation. So it's not super effective, but can work for minor acne issues.
Hey guys!
Hey!
How has the tea tree oil been working?
It's been doing pretty well on my skin. I noticed that it does have a kind of potent smell, and when I initially put it on, I definitely feel the stinginess happening within the pimples, but it does reduce the appearance and redness of my acne overall.
Hey, do you guys want to hear an acne fact?
Okay.
Oh, sure.
Well, did you know that acne is a chronic inflammatory skin condition and it affects almost 17% of the world's global population?
That's a lot of people.
Okay, so what's the next product I'm trying out now?
So we'll actually need to be going back to Shoppers so that we can get some acne products that contain benzoyl peroxide and salicylic acid.
But how does that affect my skin complexion?
Well, I'll tell you that on the way.
Oh, okay.
Over-the-counter products that contain the chemical components of either benzoyl peroxide or salicylic acid are also great for treating acne, but relatively expensive compared to tea tree oil. Products by benzoyl peroxide work by destroying the bacteria associated with acne. It usually takes at least 4 weeks for noticeable results, and it must be used continuously for results to last. Like many over-the-counter products, it doesn't affect the skin's oil production or the way the skin follicle cells are shed. Benzoyl peroxide can cause dry skin and can bleach fabrics. Interestingly, benzoyl peroxide significantly reduced inflamed skin lesions like tea tree oil, although at a greater extent. These treatments were equivalent for reducing non-inflamed bumps and redness though. Salicylic acid corrects the abnormal shedding of cells on the skin. For milder acne, salicylic acid helps unclog pores to resolve and prevent lesions. It has no effect on the skin's oil production and does not kill bacteria. It must be used continuously, just like benzoyl peroxide, because its effects stop when you stop using it. Pores clog up again and the acne returns. Using salicylic acid can cause some skin irritations, including skin peeling, burning, redness, and itchiness. Benzoyl peroxide with salicylic acid regimens are superior at early time points, but comparable with combination benzoyl peroxide and clindamycin at later time points. Both benzoyl peroxide and salicylic acid are available in many forms, including creams, lotions, washes, gels, and pads.
Okay, so hey, how was the acne package?
Well, it definitely helped my skin feel fresh and nice and definitely clean. It definitely helped reduce the appearance of the pimples on my face, but unfortunately it made my skin a little bit more drier than usual.
Hey, do you guys want to hear another acne fact?
Oh,
Sure.
Okay, so did you know that acne is caused by a combination of dirt, oil, and dead skin cells? But changes in hormone regulation, excess oil production, and bacterial activity within the skin can also contribute to acne. Also, stress and genetics potentially play a role in acne too.
Oh, okay. Well, that makes sense as to why I've always been breaking out ever since I've been stressed at work, and also when I'm on a period.
Yeah, that would be true.
Okay, but anyways, what are we doing now?
Oh, we're actually on our way to go look at the different laser treatment options.
Oh, okay.
That sounds cool.
Yeah.
Laser therapies are also another option that can be used to decrease acne. Since multiple treatments may be needed, the cost of laser therapies can easily add upwards of a couple of thousands of dollars depending on the laser therapy provided. Although side effects are rare, laser treatments may cause stinging, redness, swelling, and blistering, an important factor to consider with laser treatments. The various types of laser treatments are able to target inflammation, kill the bacteria strain primarily found in the skin called P. acnes, and destroy the oil glands within the skin's surface. Although not considered the first line of treatment, lasers can treat varying degrees of acne, especially in cases where there is no response to traditional acne treatments. Overall, laser therapies can be used as a treatment for acne, but further research is needed to determine the safety, dosage, and the long-term efficacy of these treatments.
Wow, I learned a lot about laser treatments. I'll definitely consider it.
Yeah, I totally agree. So, which acne treatment do you think is worth it at the different price points?
Well, I do think the use of like a cheaper product is best for my wallet. I think I have to consult with a dermatologist this weekend just to get a better understanding of my skin.
Yeah, I totally agree. Everyone has different skin, so the products that work for you may not work for someone else anyways.
Yeah, definitely. Thank you for watching this video.
Like, comment, and subscribe to the Demystifying Medicine YouTube channel.